Welcome back to BT. Thanks for joining us this morning. Well, as we enter flu season, health officials say it is vital to get your flu shot this year to avoid overloading the healthcare system. And joining us now with a friendly reminder is Dr. Yvette Lu, family physician. Thanks for joining us. Always great to see you, Yvette.
Yes, likewise. Good morning.
So are British Columbians finally able to go get their flu shot right now?
Yes, the flu vaccine supply is starting to come in. Some family doctor offices and pharmacists do have it, and similarly at public health, but the full supply won't be here until the end of October. So check with your...
Sorry, Yvette, you cut off there for a moment. You said check with your family doctor. Is that what you were going to say?
Yes, check with your family doctor or pharmacist.
Okay, great. So we've been talking about this for months now, but for those who normally don't get their flu shot, why should they get it this year?
This year is especially important to get your flu shot because we're also dealing with the COVID-19 pandemic. Even in normal years, influenza outbreaks can put pressure on our hospital system and our healthcare system, causing busy emergency rooms, busy hospitals, and busy doctors' offices. So the last thing we want this year is for the influenza and COVID-19 to be surging at the same time, because that increases the chance that our hospital system will become overburdened and people will not get the care that they need. When most of the population is immunized against influenza, then that protects our healthcare system from becoming overburdened. In addition, we don't know how the influenza and the COVID-19 virus can interact. We know that you can become co-infected with both at the same time, and getting your influenza vaccine will help prevent that from happening, because we don't know if having infection with one can affect how your body's immune system fights against the other virus. And lastly, because there is the chance that the hospital system can become overburdened, we need to do our best to stay out of the hospital, and that includes getting your flu vaccine and any other vaccines that you may need, like, for example, the pneumonia vaccine for people over the age of 65.
Okay, and that's the last thing we want, getting the flu and COVID at the exact same time. So for those, who might be concerned, don't feel comfortable getting the flu vaccine because they've never gotten it before, what would you say to them?
So I would reassure them that the flu vaccine is safe and effective. Most people don't get side effects. They may get mild side effects like a sore arm, or you may feel fatigued or tired for a day or so, and that's your body making antibodies to the flu vaccine. If you do have questions or concerns, it is important to talk to your healthcare provider to make sure you get these questions fully addressed before you get the vaccine. And then for children who may be nervous about getting injections, then I would recommend they get the nasal spray, which is available this year.
Great advice as always. Thank you so much for joining us this morning, Yvette.
Thank you. Good to see you.